I'd like to, first of all, pay my respects to the traditional owners of the country that we're broadcasting from this evening, and pay my respects to elders past, present and future, and the continuation of cultural and spiritual practices of Aboriginal and Torres Strait Islander peoples. I'm actually sitting in chilly Alice Springs on Aranda country, so I'm pleased to pay my respects to people of this land and this spectacular country around me at the moment. And we have speakers coming to you from Darwin, from Larrakia country, and from down in Melbourne, which is also cold as well. So I'd like to acknowledge and pay my respects to all the Aboriginal and Torres Strait Islander nations from where we're broadcasting from and where you may be viewing from as well. As I said, my name's Dr. Olivia O'Donoghue. I'm a GP and a medical and cultural educator based in Darwin in the Northern Territory, and I'm also medical director for the Flinders NT Regional Training Hub in the Top End. We are working together with key stakeholders around the Northern Territory to improve training opportunities and capacity across the Territory for postgraduate medical education. Thus, we get to bring you this series of career webinars. And as I said, tonight we've got 3 presentations and some other important guests who will be coming on during the Q&A session to help answer some questions for any of our viewers this evening. So our guest this evening is Fran Watson, who's the lead training projects person for the college, Dr. Kate Martin, who's a current trainee of the college, and Dr. Kiana Brown, who's a consultant obstetrician and gynaecologist in Top End Health Services. So without further ado, I'm going to stop sharing my screen and I'm going to hand over to Fran Watson, who's going to start sharing her screen for us and tell us all about the exciting opportunities for training with the Royal Australian and New Zealand College of Obstetricians and Gynaecologists. Thank you. Welcome, Fran.
Great, thank you very much, Olivia. And hopefully everybody can see what they need to see up on the screen. Can I just get a thumbs up from one of our presenters just to, okay, fabulous, yep. Thank you, Olivia. Lovely. So welcome everybody. I'm going to talk a little bit about some of the colleges, the Rands College training programs and pathways through obstetrics and gynaecology. So what's the next step? Well, look, first off, I'm going to talk to you about who we've got online tonight. So we've got Kiana Brown, who is our fellow, a specialist in the Northern Territory, and one of our advanced trainees, Kate Martin, who is based in Adelaide at the moment. A little later during the QA session, Julie, Marie and Natalie will be joining me from college to talk a little bit more about any questions you may have with regards to those training programs that they are knowledge owners in. But look, let's kick off with the RANZCOG training program. So we have many pathways for lots of different styles of practice. Our certificate diploma and diploma advanced are the kinds of things that we see for our GPs shared care environment. The pre-vocational pathway is something that may be of interest to those who are looking to go into our fellowship. The fellowship is our specialist program, and it's kind of the main event, I guess, the 6-year training program towards the specialty. And then we've got subspecialty certificates in 5 of the areas you can see there on the screen. For those who might want to go into something a little bit more, narrow their scope of field, I guess, and subspecialise in reproductive endocrinology and infertility, maternal fetal medicine, urogynecology, obstetric and gynecological ultrasound or gynecological oncology. All 5 of those are subspecialties that can be started a little bit later into our advanced training, and I'll cover a little bit more of that as we move along. So programs and pathways, as I've touched on, the Certificate of Women's Health Diploma and Diploma Advanced are in that GP scope, shared care scope,
Hi,
Uh,
Fran. Sorry
yeah.
to interrupt.
Mhm.
Are you progressing your slides at all? Because we are
Can you
only
not see
seeing one
those?
slide, Rand's Cog
All right.
program.
Is that progressing now?
That is now. Wonderful.
My
Thank you.
apologies. So hopefully everybody can see that on screen now.
Yes.
Let me see. I've got it progressing on my end and not your end, which is not very helpful, is it? Hopefully now you can see that that
We
flow
can see
chart.
programs and pathways flowchart on the screen now.
Excellent.
Thank you.
Great. Okay. So yeah, look, the Certificate of Women's Health, the Diploma and the Diploma Advanced, as I said, was in that that GP scope. The Certificate of Women's Health is something that is mandatory for the pre-vocational pathway. So if you are considering going into the specialty training program and looking to get a bit more of a taste in the pre-vocational area, there is that scope. Now that pre-vocational pathway, and I'll speak a little bit more to selection a bit later, but it does get points in our trainee selection process towards FRANSCOG. So it is something that we do encourage, but it's not mandatory. So that pathway, though, through the pre-vocational pathway does involve the Certificate of Women's Health, onto FRANSCOG, and then across to subspecialty training programs. So the Certificate of Women's Health, it's designed for medical practitioners who are looking for a little bit more who have a bit of interest in women's health. It's primarily office-based, and it's for non-procedural GPs, GP registrars, JMOs, and other doctors in that field. There's no minimum period to complete that. It's generally about 3 months, we find, for people to cover that off. There is some in-hospital and practice-based training, some online modules, a logbook, some workplace-based assessments, and a written exam. You can see there on screen that some of the content that's covered in there. I won't go through that in detail. I will add, we will be able to provide this presentation along with some other resources after the webinar if there's anything else that you're wanting to look at, or alternatively, all this information is also on the RANSCOG website. So on to the diploma. This builds on the pathway, the CWH, qualification. It's intended for medical practitioners who wish to gain skills in O&G. It enables them to undertake non-complex deliveries and perform basic gynae procedures as well in their practice. That's a little bit longer. Again, there's no minimum duration for the diploma. It's approximately a 6-month. We do find about approximately 6 months, though, to be dedicated to that. And again, there's in-hospital and practice-based training there, and online modules available for that support resourcing. Again, there's a logbook, workplace-based assessments, and a written exam. This one covers a little bit more with antenatal care and labour, and you can see there postnatal and neonatal care, procedural gynaecology, and basic skills. And then onto our Diploma Advanced. So this one's a little bit more of a commitment if you're looking to build on those skills of the diploma, but it does enable you to undertake those complex deliveries, some advanced gynecological procedures, as well as basic and early and late pregnancy and ultrasound. This one's approximately 12 months. Again, none of our CWH diploma or diploma advanced courses have a minimum, but there are some recommended guidelines on how long you would be committing time to that. In-hospital training and online modules. Again, logbook, workplace-based assessments. The diploma advanced has some case syntheses, and in addition to the written exam, also is an oral exam. You can see there's some advanced obstetrics and advanced gynaecology, as well as that ultrasound exposure. On to the PVP. So yeah, look, if you're looking to go into that specialty training pathway and you'd like to get some extra points in the selection, a little bit more exposure, undertake some workshops and online modules, then our pre-vocational pathway is something to investigate. Again, no minimum. There is a maximum. There's a maximum for most of our training programs. For the PVP, though, that's a 1-year time frame to complete. The CWH, as I mentioned, is a eligibility requirement for that. So you do need to undertake that initially before taking on the pre-vocational pathway. We've got Nat coming up a bit later who can answer some questions in that, that field. Satisfactory completion of online modules, evidence of attendance of workshops, which of course is a bit of a challenge under COVID at the moment, but we do have some contingencies in place to be able to meet some of those requirements. And as I mentioned, it gets that 5 points in the professional category for selection. And that covers off some of those core knowledge and skills that you'll be looking at in O&G, and giving you a good basis for commencing the specialist training program. So there you go, there's those online modules there and workshops. I won't go through them one by one. I'm sure you can all read by this stage in your careers. And again, you'll have a copy of those slides, but you can see there's a variety of topic areas that are covered both in the online modules and in the more hands-on face-to-face workshops. But look, here's probably the big one, I guess, the big ticket item, the fellowship for those who are looking to specialise in obstetrics and gynaecology. It is the only means of specialising in O&G in Australia and New Zealand. There are no other training programs. It's an apprentice style model, so that means that it's all hospital-based learning with the addition of requirements and assessments that are done through various different mediums, exams, and we'll touch on a few in a moment. There are 3 different pathways within the Franz Cog training program. Most people, we find, take the generalist pathway, which is 4 years of basic training followed by 2 years of advanced training. But there is a scope there for an academic stream. So those who are interested in a PhD can include that. That PhD needs to be in an area of women's health and needs to be completed, but on completion will give 46 weeks of credit for advanced training. So you would then follow that normal pathway of basic and advanced training through to Franz Cog as indicated with the generalist stream. And the third one there is a subspecialty stream, which I've touched on lightly this evening, which has the 4 years of basic training. Again, there is 2 years of advanced training, but of that can be 1 or 2 years of subspecialty training, generally followed by some additional post-fellowship subspecialty training. So the subspecialty training is generally 3 years, and it can be commenced any time in advanced training or post-fellowship. So we do have people who are already specialists who come and do the subspecialty pathway as well, who have completed their Franz Cog. So the generalist pathway involves that basic and advanced training. It's a rotation initially for 184 weeks or 4 years through 2 different hospitals. Of those, 46 weeks need to be, or 1 year needs to be in a tertiary site. There is a mandatory 23-week rural rotation, which if you're going to undertake that training in the territory, you will have no problems ticking that requirement off. And 46 weeks in a not-based hospital. So that allows some exposure to different environments, both in that rural sense, in a big tertiary sense, and also in some of the peripheral sites. So perhaps a smaller hospital in the suburbs. There are formative and summative assessments throughout that time. There's a written and oral exam, and there's a range of additional requirements, including logbooks, workshop attendance. There's assessment in hospital, so in hospital style assessments through the assessment of procedural surgical skills and the in-hospital clinical assessments, and some online modules including cultural competency and climate modules. Climate is our online learning platform. Following completion of that, and it is mandatory that basic training is completed prior to commencing advanced training. Going on into advanced training is 92 weeks, so 2 years. You need to have completed all those basic requirements. There's some mandatory advanced training modules in generalist obstetrics and generalist gynaecology, and it can include some subspecialty training. So there's a lot more scope in your advanced training to really tailor that to your needs and the interests that you might be going into. So maybe a little bit more academic, or perhaps something a bit more research based, or looking more so at obstetrics over gynaecology, or vice versa. So that's where that that opportunity for you to really look at what your career pathway is and what interests you. Kate will be able to tell you a little bit more about what she's doing in her advanced training, and then Kiana on what happens the other side of the FRANSCOG certification. So subspecialty training, as I pointed out, there are those 5 subspecialties. It's a 3-year full-time training. It's there are formative and summative assessments. There's a research study that's involved, and again, there's a written and oral examination in that training. So how do you get into the FRANSCOG training program? There's annually we undertake a trainee selection process, which is made up of 4 different components: your online CV application form, an applicant nominated referee, so people that you choose to be your referee, institutional references, where the college will contact hospitals where you have worked recently, generally within the last 12 months. I think it was 2 years. I'd have to double check that one for you. I'm sorry, it's not on the tip of my tongue tonight. And then there is an interview. You can see that weighting there of how that the scoring contributes to each of those components. So initially there's a shortlisting process for interview, and then following that, the interview process and selection for the training program. In that process, you do get to nominate and preference the states or territories you wish to train in. So you can say you want to be in Northern Territory, and we do encourage you to look at the South Australian Northern Territory stream, which includes training in both Adelaide and in Darwin and the surrounds. A little bit more on that trainee selection component. So you can see there that breakdown of points. I know that's something that's very important to everybody, and we're happy to answer questions in those areas where possible, or we can take them back to Elaine, who hasn't been able to join us tonight, but is our guru when it comes to trainee selection. The clinical experience, things like academic awards, some of the rurality and your Indigenous identity, there's all scoring in those areas, leadership and altruism, your research. So some of those things are things that are in your past that you've already done. You can't impact those now. If you've got honours in university, you can't do anything much about that. But if you are still studying, we certainly encourage you to look at some of those options that are on the table for you. And then into that the professional qualities and also your clinical experience. That's where you get a little bit more scope and a little bit more of a choice in what the direction towards training. Institutional referencing, as I indicated, is collected from training sites. There you go. It's a minimum of 6 months that has been spent from between February of the year of application and August of that same, before and August of the year that you are applying. Applicant nominated referees is fairly self-explanatory. That's you can nominate up to 4 referees. We do encourage you to look to include FRANSCOG consultants and also advanced trainees, and the interview process, which up until this year has always been face-to-face. This year will be, or has been for the first time, over Zoom. Our New Zealand cohort have undertaken that very successfully, and we've had great feedback. So this year we'll be doing our interviews via Zoom, and look, we'll see what happens next year. Who knows where we'll all be at? The world is changing very quickly. Look, that's pretty much all on those. I don't want to go into too much detail. There's a lot more information on the college website. Those links are there, and as I said, the presentation slides will be available for you. And again, those contacts that are available as well. Olivia, I don't know if you wanted to touch on anything. Otherwise, I will hand over to Kate to take over and and talk a little bit about what it's like being a trainee and life in the world of training.
I think we'd love to hear from Kate.
Sure.
Thanks,
Olivia,
Kate.
and thanks, Fran. I will see whether I can share my screen.
That's showing okay on my end.
I think that I'm a little bit far through, so you'll get a preview. Lucky people. All right, so thanks for having me. It's a pleasure to be here. My name's Kate, and I'm in my in my second to last year of training, and I'm currently working in Adelaide. But I have previously had the privilege of working for 6 months in Darwin, which I loved, and I'll go through a bit of that later. So my presentation is about what it's like in the life of a Franz Cog trainee, and this picture is one of my working days, actually on a locum in Canberra. And it's shot by a birth photographer and doula who we were able to get into theatre, which was a little bit of negotiating for anybody that's been in theatres. You'll be able to appreciate that rules can be strict, but it meant a lot for the parents that you can see to have their doula and birth photographer in theatre, and we got some great photos out of it. So thanks to Amy. I'll just see whether I can progress. Please speak up if you can't see my slides. So
They're looking good.
I think that being a Franz Cog trainee is one of the best jobs in the world, and Kiana might disagree and think that her job is even better, having been on the other side of the training program. But really, you're never going to get bored as a ONG trainee. And if you are, then I haven't met one yet. You get a lot of variety in your day-to-day life, so every day you're doing something different. There's a lot of emergency and excitement in ONG. At times there's no emergency and you can have a cup of tea, and that's great. There's always the combination of medicine or really physiology a lot of the time. And then you have the surgical component, both in obstetrics and in gynaecology. There's other things that you can do. There's ultrasound, there's the subspecialties that Fran's mentioned, but even within generalist ONG, people often have special interests, say sexual and reproductive health, ultrasound, high risk obstetrics, office gynaecology, colposcopy, and vulval dermatology. There's so many different aspects that make up this specialty, and you can really find the niche that suits you. And as a trainee, you get to rotate through all of them so that you can find what you like, what makes you excited about coming to work. There's also the academic pathway, and the college is really encouraging that. As you can see from the slides that Fran's gone through, you can choose a research pathway, and any research that you've done will contribute to points towards the training program. And then there's also the interpersonal aspect, which I think is one of the most nuanced and rewarding parts of the specialty. You've got the patient and the family that you're dealing with at a really important life moment in obstetrics, or multiple of them along the way. You've got your collegiality. It's a really close-knit team, both between consultants and registrars, from registrar to registrar, the junior doctors that you work with, and the multidisciplinary team, midwives, physios, continence nurses, anaesthetists, the fantastic other specialties that you might call on for their expert knowledge if a patient starts moving outside of the subspecialised knowledge base. It's a really fun and inclusive place to work. So where can training take you? Basically anywhere, and you can help to guide this, but you will be, as we mentioned, rotated through tertiary and peripheral hospitals, including metropolitan and rural. You can choose to undertake overseas fellowships or training, and that can be counted towards your training time. And there are grants that support that, including aid work. You can attend, and you will attend, conferences and workshops. And trainees are required to present as part of their research component at conferences. Who knows what that will look like in COVID, but this is what it looked like previously. And undertake research and get involved in advocacy and leadership. So I was invited to speak here as the SANT trainee rep, and that's a role that I've really enjoyed. And there's multiple other leadership and advocacy pathways throughout the college for people to get involved with. Some of these pictures are from conferences and workshops, and part of my rural rotation. And I'll just mute this. So another day at the office, as I said, is never boring, and particularly that was true when I was working in the Northern Territory in Darwin, which I loved. This is my friend Becky, who travelled to one of her outreach posts with a joey that had been rescued from the side of the road. And you can see some outreach clinics at Elcho Island there with the colourful blinds, and me in a tiny little plane sitting up next to the pilot, which I was very excited about. And then over on the right hand side of your screen there's some pictures of my friend Becky, who is the same year as me, travelling to the Solomons to complete part of her training modules, which looks like a fantastic thing, and I know she really enjoyed it. Unfortunately, that was cut short a little bit because of COVID. Work is really day-to-day work. As I said, it's a combination of various shifts. So you might be on delivery suite, which is usually a long-ish shift. You know, most places would have a 12 to 13-hour shift. So if you're lucky, you might get to be quiet when not have much going on when the sun's rising, and be able to watch that from the top of the Darwin Hospital, like Lakshmi is doing in the centre there. You might be teaching medical students or your junior doctors about the mechanisms of labour and delivery. And as you can see, a slightly creepy but useful model with a floating fetal skull of a maternal pelvis there. You might be on roster 2 caesareans. You might be in gynaecology theatre. One of my colleagues there helped to deliver her boss's baby at the time, which was quite an experience, and you can see the happy 4 up in the top corner. And then you can also rotate through various subspecialty rotations, as mentioned before by Fran, gynaecology, urogynecology, ultrasound, maternal fetal medicine. We don't really rotate through reproductive medicine, but a combination of the other ones you would certainly get exposed to during your training program. And that's really from a SANT perspective. It may be different interstate. So I think that the FransCog training program has been really aware of helping trainees to achieve as much work-life balance as is possible. It is a demanding training program. You know, hours can be long depending on your rotation. You may have on-call requirements, but there is capacity to work part-time, to take parental leave and extended leave, and to have supported return to work. The college has established a training support unit and is very proactive about work-life balance and trainee health. You can really make life as an ONG what you want it to be in terms of your lifestyle. as a specialist, and Kiana probably can talk to that a bit more, but certainly you see that modelled in your bosses. Some might just purely work in public, others do a combination of public or private, others work in private. You don't need to be at work all the time or be on call all the time. There are group practices that share on-call responsibilities, so please don't be scared that you might like O&G, but you don't want to sacrifice lifestyle. There are definitely ways and models of working where you can maintain that. And I think that the FransCog community is really, in my view, more like a family. It's a very supportive and inclusive training program to be a part of. You do make close friendships that you'll keep for life. This is a picture of the people that I was rotated to Darwin with, who I would refer to as my Darwin family, and we keep in close contact and even fly interstate to see each other, before COVID, to all catch up as a group. We came from different states. It's a rewarding and fantastic program to be in, and I would encourage anybody that was considering it to pursue it, because it's definitely worth all the time and effort that you put into to getting in and to working your way through it. And I think that is it, and I will now hand over to the fantastic Kiana Brown.
Thank you so much, Kate. That sounds really exciting. Just before we get to Kiana, I was just wondering, your 6 months that you did in Darwin, was that part of your mandatory rural rotation?
Yeah, so as a South Australian NT, it's a shared program, but really the majority, just with numbers of trainees would be based mainly in South Australia, and there are a few rural rotations that you can go to. So you can either be rotated to Darwin, Mount Gambier, and then it varies depending on what other sites are available. But certainly people that have wanted to rotate to Darwin, as the trainee rep, I sit on the committee that kind of discusses such things, and it's always something that we are very keen to support for people wanting to train in Darwin specifically, to facilitate that, and the consultants who are from the Darwin Hospital that sit on that committee, which is currently Jane Thorne, will definitely advocate for that to happen. But I was rotated there for 6 months. Best thing that ever happened to me in my training, I think.
I worked on Elcho Island for quite some time, so I was reminiscing for seeing those pictures.
Yeah.
Thank you. We'll hand over to you, Kiana.
Thank you very much, and thank you, Olivia, for inviting me to be along, to come along to this webinar. Kate, can I get you to flick to the next slide, please? I'm going to start by just acknowledging that I am coming at you from Larrakia country. I work in Darwin, I live in Darwin, I was born in Darwin, and I'm very proud to come from Darwin. I'm not Larrakia, but I do certainly pay respects to Larrakia leaders, elders past, present and emerging. I'm just going to go through a few things about where I work, a little bit about me and how I got to be here, a little bit about what I do, and a little bit about what I wish I could do and why I love living and working in the NT. I'm going to apologise now for my technology. My computer's being a bit slow today, and Kate will be kindly changing the slides for me. But generally there'll be lots of pictures and a bit of chit chat. Thanks, Kate. Oh, that's fancy. So these are pictures of the Royal Darwin Hospital through the ages. And the top middle picture is the original Darwin Hospital that was at Myaley Point, and the existing, the first hospital in Darwin. Underneath that is what Royal Darwin Hospital looks like now as we know it, and most people will be familiar with that. And actually it was the hospital where I was born. It was opened in 1980, so there you go, you know how old I am. The picture to the left of the screen is one of my favourite pictures to show in a slide. It reminds me that the Royal Darwin Hospital is a very exciting place where lots of magic happens. Essentially, the Royal Darwin Hospital is a 345 bed teaching hospital. We have about 2,200 babies at Royal Darwin Hospital every year, and about 30% of the population that we service from the Obstetrics and Gynaecology unit will be Aboriginal women from remote communities. In terms of, you know, O&G units, in comparison around the country, we're a small but clinically very busy and very challenging unit. And we certainly see things that I'd never seen previously in my training before I came to Darwin. There are about 12 O&G specialists that work at Royal Darwin Hospital, and we also extend our services to the Palmerston Hospital now. And we all work at various full-time equivalents, so part-time and full-time. We have about 10 or so registrar positions as well, full-time equivalent. And our registrar positions are made up of advanced trainees, trainees in their core training, people who are doing the DRANSCOG and DRANSCOG Advanced, and people who are just trying some time in O&G that haven't decided on which specialist training pathway they'll go down yet. We have RMO positions as well. We don't tend to have positions for interns, but at RDH you can do a 3-month rotation in the O&G unit. And we also have longer RMO terms for those who are wanting to do a basic diploma or a certificate in women's health, or who think that they might be interested in O&G training. Those positions are usually very popular, and they are snapped up fairly early. So if you are someone who is interested in working in O&G as an RMO at Royal Darwin Hospital for more than a 3-month rotation, then you should let us know early about your interest. Thanks, Kate. Yeah, so just a little bit about my pathway into training. So there was no medical program in the Territory when I was a medical student, unfortunately. I would have loved to have been at home and studied at home. But I did, the middle picture is a picture of the University of Western Australia, where I did do my medical undergraduate degree. I'd never been to Perth before I started my medical degree, and I'm certainly not sorry that I went there. It was a great experience. And I did my 6 years of undergrad training there. I decided to leave Perth for my intern year, and ended up, sorry, these pictures haven't come out quite as planned, but I ended up at the Townsville Hospital for the first couple of years of my training. And it was at the Townsville Hospital where I started to, well, actually, it was during my medical student rotation where I really started to develop an interest in obstetrics and gynecology, and really got a taste for things, and thought that it might be something that I'd be interested in the long term. I went to Townsville. I did a 3-month and then a 6-month rotation in O&G, and I really developed my love for it there, but thought that I might be a rural GP really, with an advanced diploma, and work in the top end of Australia somewhere, do it as a GP obstetrician. I moved down to southeast Queensland and eventually got into training in O&G training in southeast Queensland. And the picture to the left of the screen is a picture of the Royal Brisbane and Women's Hospital, where I did part of my training as well. I did my core training in Queensland, and then I came up to Darwin as an advanced trainee and spent a year here before going down to having one last stint interstate and going to Hobart, which is what the picture to the right is, that unfortunately hasn't come up very well, but basically that's a picture of, oh no, that's the Townsville Hospital. There was a picture of the Royal Hobart Hospital with Mount Wellington in the background. So I've ended up back in Darwin following the completion of my training. It's taken me years and years to get to this point, and I've been all over the country, but I now live in the best place ever, in my opinion. Next slide, thank you. As Kate's mentioned, O&G is a very varied career, and as Kate has also mentioned, you can really design your own career depending on where your interests lie. So O for obstetrics and G for gynaecology, and both of those, so we do a dual specialty in O&G training, and really you can come out as a generalist doing both O&G, or along the training pathway you might find areas that interest you more specifically. And you don't necessarily have to do subspecialty training to have a special interest in something and to do mostly that in your career. But my day is very varied, and I won't go into it. Kate's discussed most of it, but you know, there are days in obstetrics, there are days in gynaecology, there are days in research and advocacy and policy. Overall though, it's a busy yet very fulfilling career. And the good thing is you don't have to do it all, and you can be, as you advance in your training, you can actually be a bit more picky and choosy about what kind of jobs that you think you might like to do towards the end of your training. And certainly once you finish your training and become a specialist, you can kind of design your own career, really. Thank you. Just a map of the territory. Again, most people will probably be familiar with this. So the top end health service, Darwin and beyond, we cover everything that's in the kind of green and blue shades, and then the central health service will cover the red and orange. Why am I showing you this? Well, because at the Royal Darwin Hospital, we essentially cover the population in all of that green and blue. And so as you can imagine, there are, you know, obviously hospitals in Katherine and Nhulunbuy that have obstetric services, but we as gynecologists in Darwin will cover that whole area. And in fact, for women who have more high risk pregnancies that live locally to the Katherine area or the Nhulunbuy area, if they have risk in their pregnancy, then they'll come to Darwin as well. So it's a big area to cover. And most of us are generalists with a range of skills, and plenty of us have special interests, but essentially we work together covering that whole big area. Thank you. So what do? Well, this is what my working week looks like, and I must admit that trying to find some work-life balance has been extremely important to me, and maintaining that work-life balance. Some weeks that works out well, but other weeks maybe not so well. So I do a combination of both obstetrics, both public obstetrics and gynaecology, and then I spend a little bit of time at Darwin Private Hospital doing a little bit of private gynaecology only. I don't do any private obstetrics at this point in time. Maybe into the future, but I'm just not ready for that yet. So on Mondays, I'm at the Royal Darwin Hospital. I do some work in our day pregnancy assessment unit, which might mean just assessing women who have gestational diabetes and need scans on their babies, or talking to women towards the end of their pregnancy about induction, or women with small babies that need a bit of monitoring and some reassurance. On Monday afternoons, I'm in the gynaecology clinic at Royal Darwin Hospital, and I see a whole range of presentations from adolescent women to women with postmenopausal issues, women of childbearing age with abnormal pap smears, for example, or problems with their menstrual cycles. I never know what's coming. And so it's always very varied. It's a general gynaecology clinic. On Tuesdays, I'm at the Darwin Private Hospital, and most of the times I'll be consulting in the mornings. I wait for the GP referrals to come in. I see a lot of Defence Force women in my private consulting rooms, and then in Tuesday afternoons, I'm in the operating theatre at the private hospital. On Wednesdays, I have the pleasure of running an antenatal clinic for remote women. I cover essentially the top and west part of the territory. So I see women in pregnancy from the Tiwi Islands down to Wadair, and part of my job is to cover women from East Arnhem Land as well, who may need to come to Darwin for their pregnancy care. On Wednesday afternoons at the public hospital, we have a dedicated teaching session, and sometimes on a Wednesday I do some gynaecology outreach clinics. So we have specialist outreach clinics to all over that top end health service coverage area, and I go to 3 different communities, but I'm out on outreach about 10 days a year. So on one of the little planes with my registrar and my outreach nurse, we go out, we do anything from colposcopy, which is an examination for women with abnormal cervical screening. I might do some preconception counselling, I might do some infertility counselling. I see, again, a whole range of general gynecological issues. The outreach is amazing, and it's probably one of the things that I love most about my job. I get to visit communities fairly regularly and build some really good relationships with the communities, the women out there, the staff out there as well. And the longer I spend in this job and the more frequently I go out, the more people are getting to know me. And that really makes a massive difference to healthcare in those areas, because, you know, over time, these women feel like that they've got, you know, someone who's been around a little while and someone that they can hopefully trust. On Thursdays, I'm still at the Royal Darwin Hospital, and every second week I'll do an on-call day, which basically means I'm on call for the delivery suite and the emergency department and the ward from 8 a.m. Thursday morning to 8 a.m. Friday morning. Doesn't necessarily mean I have to be at the hospital for 24 hours, but a lot of the time I'm there for all day, some of the night, and then maybe intermittently in and out through the night, depending on how senior my registrar is or what's going on in the delivery suite or in the operating theatre. If I'm not in call, I spend the day in theatre, and I do gynaecological theatre at both Royal Darwin Hospital and Palmerston Hospital as well. Friday's my choose your own adventure day. Sometimes I spend it recovering from my on-call. Sometimes I have some theatre cases at the private hospital. It's usually when I'm catching up on the washing or stuff to do at home. But also, you know, if I have a meeting or need to catch up or do some other research stuff, Friday is my day to do some of that time. So I work full time, mostly, but I spread my time over all sorts of everywhere, lots of different locations, really. Thanks, Kate. So what are the advantages and what are the challenges of being an ONG, and particularly an ONG in a territory? Well, I think the advantages and the challenges are exactly the same thing. You know, we see lots of varied pathology in the territory. We see lots of high-risk obstetrics. We see lots of the weird and wonderful, and that's great. That's awesome learning, and you know, I get a bit better each time at managing those really high-risk pregnancies. But it's also caused me to go a bit grey as well, and certainly there's a lot of worrying involved. This is a picture of a woman who's from that community that you can see, which is Wadair, and you know, it never ceases to amaze me when we're up in one of those little charter flights that there can be an expansive country and nothing to see for miles, and suddenly you see this little remote community pop up. But this is a lady who'd had a heart valve replacement in her 20s, secondary to rheumatic heart disease, and we tried so long to, you know, to not to advise her against getting pregnant, but she was pretty determined that she wanted a baby. So I looked after her during her pregnancy. She gave me a few grey hairs, I can tell you. But this is us about 5 months later when she came to see me in one of my outreach clinics with her beautiful, beautiful little girl, and she was so happy. And although it was challenging, it was certainly very rewarding to see that. The remoteness of being in the territory, you know, is a challenge, but it's also gives you the greatest reward. Being a generalist and not a subspecialist, you know, is a challenge because, you know, sometimes one day I'm doing a laparoscopic hysterectomy and the next day I'm, you know, trying to manage someone with, you know, severe rheumatic heart disease and ultrasound scan abnormalities in their pregnancy. But it's also gives me a sense of satisfaction as well. And, you know, it's busy, it's really busy, and that's a challenge, but it also is an advantage because it's always fulfilling and there's always something new and exciting happening. There are bad outcomes sometimes, but, you know, these are far outweighed by the good outcomes. Thank you. Look, just very quickly to say that, you know, there is heaps of work to do in the territory. There are certainly things that, you know, health outcomes that we want to improve, and now is the time. Into the future, there's still lots of work to do to improve health outcomes, and I guess I just wanted to touch on that and say that's kind of one of the reasons why I'm here as well, because there is really room to make a difference for health care. And just to finish, thank you, Kate. Why else would you want to work anywhere else but the territory? We have beautiful sunsets. We've got amazing country. We can maintain a good work-life balance. There's no traffic. The work is satisfying, and the opportunities are endless. And you really can design your own career. And that's really all I had to say.
Thank you very much, Kiana. It was really wonderful hearing from our local specialists, and hearing Kate's journey as well. And I can attest, as can Kate, that watching sunsets from the sunrises from the obstetric unit at Royal Darwin is very beautiful, and quite a pleasure to see. It was really wonderful hearing about all the opportunities in the NT. I'm just going to hand over to Fran again so she can quickly introduce some of our new guests, and I'll just get Kate to unshare her screen so that we can bring our new guests up on the panel so everyone can see them. So Fran, if you wouldn't mind introducing everyone for us, and maybe a couple of minutes what everybody does, and how we can get in contact with everybody after this webinar to find out more. That'd be great. Thanks, Fran.
Absolutely. So look, as I touched on a little bit earlier, we've got a few people from College House, from RANZCOG here, all here in Melbourne in lockdown. We've got Julie Wise on the line, who is taking over as the specialist on RANZCOG training. We've got Marie Brislin, who is our diploma and CWH guru. And Nat Valla, who has taken PVP pathway right from inception through to now. So all three of those are on the line if anybody has any questions, or for any of us three also who have spoken. I shall also bring up, if you like, those contacts again, just in case you wanted to get a hold of anybody. Bear with me.
I was thinking it might be good to hear from Marie about the opportunities to do the certificate in women's health, the diploma and advanced diploma in the Northern Territory, if she's got that info.
Sure, Shan. Hi everybody, I'm Marie Brislin. I'm the CWH Diploma Training Programs Lead, and I think Fran is looking forward to tracking down the email address for anyone to contact me at any point in time if you are interested in any of our 3 programs that RANZCOG run: our Certificate of Women's Health, our Diploma of O&G, and our Advanced Diploma of O&G. They are designed for GPs, however not limited to. The Certificate of Women's Health can be undertaken in a GP clinic. Just need to organise a mentor to oversee your training. They don't necessarily have to be in the clinic with you, however they can be. Eligibility for the mentor, they just need to have a diploma or a FRANZCOG qualification, and you can complete that in a clinic-based setting. However, it can be done in a hospital as well. So all of our accredited sites, which are listed on the website, you can undertake our CWH, our diploma, or our advanced diploma there. I think Fran sort of highlighted there's a guideline minimum of 3 months to complete the training requirements of the CWH, maximum of 2 years. And with the diploma and the advanced diploma, you're looking at sort of a 6-month minimum to a 4-year maximum, and a 12-month minimum for the advanced to a 4-year maximum. And they're quite generous training timeframes, and that is because they are designed around GPs who may want to gain some additional training or expertise in the area of women's health. So we've built in a nice, we hope, a flexible training time frame to allow GPs to step away from their busy practices, particularly for the diploma and the advanced diploma, because there is hospital training time that's involved with those 2 programs. Yes, there's some logbook procedures. It is sort of prescriptive. There are certain procedures that need to be met. The curriculum does sit on the website, so if you're interested to see sort of what the scope of practice for a certificate holder, a diploma holder, an advanced diploma, all of that information is available on the website. So please have a look. Otherwise, don't hesitate to contact myself, and I'm happy to answer any questions. Registration is really available online. The applications are downloadable from the website. Intake is any time of the year, so it's quite different to FRANZCOG in that respect. There's no intake date. Employment or registration basically aligns with employment. So if you would secure a training position at an accredited site, the hospital is happy to support you. There's obviously limited post numbers, so the hospital will need to manage who is incoming and who is outgoing to be able to take a certain amount of trainees. But it basically aligns with securing a job. Enroll, send it into College House, and it will all fall into place, and you'll be sent out your training documentation.
That sounds wonderful. Thank you, Marie. And I believe Kiana might be able to confirm, but I believe you can undertake all 3 of those qualifications, both at top end health services and Central Australian Health Services at the moment. So that's really exciting for everybody. Yeah. And it's great to know that there are lots of opportunities to gain some additional skills in the territory in women's health and gynaecology and obstetrics, even if you're not going down the fellowship pathway, because there's lots of rural and remote communities who will benefit from our general practitioners and rural generalists having those skills in those communities as well, who will work very closely with our consultants at both of our top end and Central Australian Health Services. Thank you very much. I was wondering if maybe Natalie might be able to tell us a little bit more about the pre-vocational pathway workshops and where people might be able to undertake those workshops and whether any of them are available in the NT. And Fran alluded to some changes during COVID times, contingencies of how people can do the workshops to complete their pre-vocational pathway?
Sure.
Training.
Hi, I'm Natalie, and at the moment it's a little bit of a challenge because of COVID and face-to-face, particularly with workshops. So generally we have a wide scope of workshops that participants can undertake, and they can undertake them even before they apply for and enrol in the PVP. At the moment we're currently jigging things. So, for example, the basic obstetric skills component, you could, for example, do a prompt course, and I understand that a lot of those courses can be run in hospital. There's also those also courses, which is, as I understand, they're on hold at the moment. So it is a little bit tricky as to which courses are online. And so I guess we are going to be a lot more flexible as it unfolds with COVID. So we might be accepting, for example, purely online courses that participants can undertake. So I don't really have a solid answer just in regards to those workshops, because a lot of hospitals and providers have put them on hold, and we are monitoring it at the moment. So we are going to be flexible, and it's going to be very much a case-by-case scenario in the coming months. But as I understand it, there are some providers who are doing purely online courses or webinars. And another example would be the fetal surveillance, which the RANSCOG FSCP course is quite popular, and a lot of the participants do that. And so we're looking at the possibility of online and webinars for PVP participants, as opposed to that face-to-face course that they normally undertake. So I hope that answers the question somewhat.
It was obviously a trickier question than I anticipated. I apologise.
No, that's okay. It's because it's unravelling, and it's a case by case at the moment, because like Victoria's in lockdown right now, so everything's on hold. So it's
But sounds like if anyone is interested in undertaking the pre-vocational pathway, they should just get in contact with you guys to work out how they can navigate during the current times.
There's a few changes in the PVP sphere happening in the next 6 weeks. We are opening on the 1st of September for enrolment. So I strongly encourage people to go to the website, and because there are going to be some new modules that will be added, and there will be some other exciting changes. So I encourage people to go to the website and call me, contact me, email me.
Thank you. I just have one last question for anybody. Both Kiana and Kate have really pumped up the college and a career in obstetrics and gynaecology that promotes a good work-life balance, choose your own adventure, ability to manage self-care. And I was just wondering, from a college perspective, what programs and strategies that you have in place to support trainees and new fellows to navigate that and look after themselves and their communities.
I might let Julie speak to that one, since she hasn't said anything today, and look, possibly following that, Kate might also be able to talk to just her experience and some of the support resources that are available as well.
Great.
Lovely, thank you. Thanks, Fran. Hi, everybody. Please chip in, Fran, Nat, and Marie, if I miss anything. With respect to supporting trainee and member wellbeing, the college has acknowledged that this is a really important part of a trainee's journey. And a while ago, they did establish what we call the trainee support unit, and we do have a trainee liaison officer I think that's her title, with a psychology background, where trainees and members can speak confidentially with her and seek to bounce ideas and thoughts with her. The college also has partnered with an external company called Converge. That's where trainees, training supervisors and members can access. It's a 24-hour, 7-day-a-week service whereby the college pays for 4 sessions and more if it's required in terms of counselling or any other support and assistance in that respect. More recently, at the beginning of the year, the college appointed a wellbeing coordinator, Claire Wells. She is amazing. She's done a lot of great work both in establishing a wellbeing working party for college members, which is a combination of trainees and fellows to sit on the working party to look at strategies, initiatives around the wellbeing space, particularly with respect to mental health. At the college, for staff, we also have a wellbeing committee whereby we look at activities, and we work closely with Claire. She sits on both committees and sharing ideas of initiatives and activities that might sit across both College House or and the States and New Zealand offices, as well as to the general broader membership base as well. Claire at the moment is working with Carly, who is our trainee liaison officer, looking at mechanisms and support mechanisms for trainees in difficulty as well. That's one area that we, the college received quite a lot of feedback with through surveys. So they are very much aware of the need to support trainees, training supervisors, and as I said, the broader membership base as well. So I feel that certainly even within the last 6 months there's been a lot of effort and energy going into the wellbeing and mental health space because we realise the importance of supporting, as I said, the trainees and the members in that area.
Yeah, I completely agree. The college is quite progressive, I think, for an essentially a surgical bent college, not especially surgical, but is very progressive in that regard, and it's fantastic to see. I think the trainees are certainly seeing the benefits of it. In terms of your question about practicality of work-life balance as a trainee, I just, for people, I might be telling people to suck eggs, but the RANZCOG is basically a training body that spans a series of employers, like the hospital that you work in. So when you get accepted into the training college as a core trainee, you are usually assigned to an ITP, which coordinates as a series of hospitals in a state, in a big state such as New South Wales or Victoria, or one site that expands across SANT. But they will then recommend as a core trainee that a hospital employs you, which always happens. So you will get sent contracts for your first 1 to 4 years, and then as a 5th and 6th year on your advanced training, you then apply for jobs, and you can then move more freely across states, etc. And there is the capacity to move across states before that, but all of that background to say that it really depends on the hospital or the site that's employing you to negotiate with them about your working hours. So say you have family commitments, or for another reason you don't want to work 1.0 or full-time FTE, it's really a negotiation to be having on a contract level with the hospital that is employing you and paying you. The college, from a college perspective, it's extremely easy to put in the paperwork to say, I want to work or I want to train at 0.5 or 0.8 or whatever it might be. But just on a practicality level, trainees should, or prospective trainees should be aware that that can be sometimes a little bit tricky. There are definitely ways around it, and there's a lot of, I guess, maybe underground or knowledge that isn't on the website from trainees. So your state trainee rep, which would be me in SANT, or if you were looking, if you're currently in the NT and you're thinking about applying for an interstate program, the college now has dedicated email addresses that you can speak to the trainee representative about any concerns in that regard. But it certainly is possible. But like with any job, it's a little bit of negotiating.
Great, thank you very much. I'm very aware of the time, so I think we might bring the evening to a close. I'm just going to share quickly our regional training hub contact details. And if you want any more information about the Regional Training Hub and our Career Pathways information and access to the filmed webinar, it'll be available on our site. And as our presenters have said, we'll have access to their slides through this and by other means as well. I have a quick 3-question poll just for any of our viewers, which will pop up on your screen now, which will take a couple of seconds just to scroll through and answer those 3 questions. I'd like to formally thank all of our panellists for this evening, Dr. Kate Martin, Dr. Kiana Brown, Fran Watson, Julie, Marie and Natalie coming in at the end there. It's been very informative. And for anyone who's interested in a career in obstetrics and gynaecology, sounds like there's plenty of opportunities and support right across the country. We will finish this evening now. Thank you very much for participating. We look forward to seeing you in our future webinar series. So thank you very much, and we'll stop broadcasting now. Thank you.